Hello everyone, this is Vishali. I really welcome all of you on my YouTube channel. So guys, in today's video, I'm going to teach you how to perform Isbar station. Isbar station is particularly the station which is short station in your Osce examination. If you want to become a registered nurse in Australia or if you want to become a registered nurse in New Zealand. This station is very important. So today I'm going to teach you about this station. So the scenario in front of you is here. So here is the patient's eye, that is the identification, background, situation, assessment, and your recommendation. So you need to verbalize all the data to the patient, to the second nurse, in a very precise manner, in a very in a summarized manner. It should be very precise. So ISBAR is the handover that you're going to give to the doctor, to the nurse. It depends, or the respiratory nurse, or the physiotherapist, or the or the nutritionist, dietitian. It can be anything. So you are going to give the handover of the patient to the second person, okay? And you going to have 5 minutes to read the file of the patient, full 5 minutes to read the file of the patient. But don't waste full 5 minutes. Just scan it for 2 to 3 minutes or maybe less than 2 minutes, and then just take the file and go to the patient bedside. So you will enter into the room, into the station, you will enter, then you will just stand there, you will tell your name, you have to verbalize your ID. My name is Vishali and I'm a registered nurse. And then after, the person will come to you, they are going to give you the file, they will tell you, you have 5 minutes, read it and just let me know. So you have to scan the full page for at least less than 2 minutes. Once you will scan the file, tell them, okay, I'm ready with the handover. Can you please tell me your name and role? For example, my name is Sarah and I'm a respiratory nurse. Okay, Sarah, let's go to the patient's bedside. Then after, you will go to the patient bedside and now it's time to give the handover. So guys, how to start the handover? That is the most difficult part. What I feel usually students experience, they don't know how to start it. So you have to tell them, so Sarah, my patient name is John Doe. His date of birth is blah 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 XXX. His MR number is 123456. You need to check these parameters, with the patient also. You have to acknowledge the patient. Can you please tell me your name? Can you please tell me date of birth? Do you have any allergies? Full stop. And once you're going to start the handover with the second nurse, I'm so sorry, light is gone, but no issue. We will continue with the class. So in case, if you are giving the handover to the another nurse, you need to make sure you share the data with the nurse, with the second person, by giving the personal details of the patient. So the name, date of birth and MR number and allergies. So here is my patient's name, this is my patient's date of birth, and this is the MR number, and patient is not allergic with anything. Currently is the situation. So ISBAR, identification, done. S, situation. Currently, you have to use this phrase currently. Currently, my patient is conscious and warm, maintaining saturation on room air, but I'm concerned about the data that you have understood from the file that you scanned for within 2 minutes. So the current situation will be the problems that patient is experiencing currently. So that will be the situation. So currently, my patient is conscious and warm, maintaining saturation on room air, but I'm concerned about XXXXXXX as he is diagnosed with pneumonia, for example. Full stop. Number 3, on the background, he was admitted. Full stop. Whatever the data when he was admitted will come under this background, including the histories. And he's also having a history of X, he's also having history of X, he's also having history of X. Full stop. ISBA, A is assessment. All the lab findings, all the current vitals. As I mentioned you earlier, his vital signs are stable. Other than that, no X-ray has been done. Other than that, here is the troponin I reports. Here are the ABG analysis report. Here are the LFT reports. So all the reports, including your vitals, the current vitals, will come under your assessment. And last is recommendation. Always start your recommendations with medications. So patient is getting all these regular orders. I have given, but there are some due orders. Please have a look. As she is a respiratory nurse, you need to tell her that these are the medication patient is getting, but there is no any bronchodilators or no any kind of steroids. Please just analyze the medications, and if you want to ask, or if you want to if you want any review from the physician, please just let me know. I will talk to the doctor and we'll make sure we add, such kind of drugs that you recommend or that you think that will be very beneficial for the patient. Other than that, recommendation, there is no any PRN order. But if you feel the PRN medication, this medication can help the patient, please just let me know. Full stop. And as a respiratory therapist or respiratory nurse, what special recommendation you should initiate? I will make sure that I'm not going to let the patient get off from the bed all alone as he's experiencing infection, as he's experiencing pneumonia. We'll make sure that we'll maintain the isolated environment in the room, and we'll ask the patient's relative not to come in the room unnecessarily. We'll also going to provide the surgical mask for the patient. But please make sure whenever you need me for any therapy session or for anything, please just let me know. And if you need any X-ray for the patient, or if you want any special lab investigations for the patient, or any PFT, pulmonary function test, or any current ABG analysis, please just let me know. I'm going to provide you that. And there is no other, whatever the lab test has been done till now, if you recommend or if you want the reports, please just let us know. We'll talk to the physician. So she is in between. Physician is somewhere the third party now. So you are the first one, the second one is the second nurse, the respiratory nurse, and third one is the physician. So always, whenever you are giving the interventions, make sure you are giving the interventions in this manner, not direct to the nurse or not direct to the doctor. It should be we'll check with the physician and we'll proceed with this. एंड दीज आर द बेस्ट थिंग. आई होप गाइज आपको बहुत क्लैरिटी मिली होगी इस बार स्टेशन को लेके. एंड इफ यू वांट अदर वीडियोस रिलेटेड टू ऑस्की स्टेशंस, प्लीज जस्ट लेट मी नो. एंड थैंक यू सो मच.